Hi, my name is Reagan Seba. This is my nasogastric tube insertion video. So this patient, Mr. Jones, has some abdominal distension happening along with nausea. The provider has ordered an NG tube to be placed in order to remove some of the contents of their stomach in hopes that that helps with the distension and nausea. So I am going to, sorry, I've got a little bit of congestion happening. I'm gonna check the chart to make sure that the patient's order is in. I have checked the chart, everything is in order and in his chart. So then I'm gonna gather my supplies. I have a syringe here, a nasogastric pump that is 16 FR, which is a normal size for the tubing. And I'm checking the expiration date on that on my syringe. I've got my lubricating jelly, check the expiration date on that. My pH strips, which I've also checked the expiration date on, everything's within normal limits. I also have some tape, a tongue depressor, a safety pin, a emesis basin, and a waterproof mat to put over the stomach's chest while I'm doing the procedure. So now that I've got all of my supplies gathered, I'm going to go into the patient's room. Knock, knock, knock. Hi, Mr. Jones. My name is Reagan Seba. I'm going to be your student nurse today. Can you tell me your name and date of birth? Okay. Perfect. Do hand hygiene, check for patient safety. Everything's safe. Mr. Jones, can you tell me if you've got any allergies? Awesome. I am going to put on some gloves here.
Solution and air against it, and then basically what I will want to do is I will want to put the eye level and make sure I force their nose.
So Mr. Jones, I know you've been having that stomach pain. You've got some stomach distension happening, and that's what's causing that pain and nausea. So the provider has ordered for us to put in an NG tube, and what that is it's a tube that goes up your nose all the way down your esophagus, or like your feeding tube almost. And down into your stomach, and then we'll hook it up to suction, and it'll start to pull some of that air and fluid that's causing that really significant discomfort for you out, and hopefully will make you feel a lot better. Okay? Awesome. Do you have any questions about that procedure? No? Okay. So I am going to raise Mr. Jones into a position of comfort for him and for me. I'm going to provide privacy. That's close. And put him in the high Fowler's position. Mr. Jones, we're going up. Perfect. The next thing that I'm going to do is I'm going to get my supplies on the bedside table over here. Alrighty, Mr. Jones, I've got an emesis basin for you right here if you start to feel nauseous or like you need to vomit. I have this fun napkin to go under your chin. This is just to make sure that we keep your gown clean and just make you feel comfortable. And then I get the rest of my supplies ready. Let's see. My tape is hiding. I'm gonna get this tape right here. Available for me. All right, so the first thing I'm going to do, Mr. Jones, is I'm going to measure this to your stomach. And we're just doing this so I make sure that I place it correctly in your stomach instead of somewhere else, or don't get it all the way down there, okay? So I'm going to measure from your nose to your ear right here, and it's about 17 inches to your ear. And then I'm going to measure from there down to your xiphoid process, which is right on the tip of your sternum, and that's about where your stomach is. And that is 64. I'm going to take another piece of tape and mark 64. And that's my marker for getting it all the way in. Okay, so the next thing I'm going to do is I am going to lubricate this. And I've done an abdominal assessment prior to this, just to make sure that that distension is still there and he's still feeling those same symptoms, and he was. So I've lubricated 2 to 4 inches, and then I decide that I'm going to do the left nostril. Okay, Mr. Jones, I'm going to have you lean your head back at the start, and then when we get to your about your pharynx, just the back of your throat. I'm gonna have you touch your head to your chin, or your chin to your chest. And then I'm gonna advance it, okay? And when you put your chin to your chest, I want you to swallow, because that's gonna help me get it into your esophagus versus your trachea, okay? All right, so we're gonna start inserting, okay? And start inserting. And Mr. Jones starts to gag and cough, which is normal for reaching the pharynx. All right, Mr. Jones, we're gonna have you lean forward. Touch your chin to your chest, and I'm gonna keep advancing. Can you swallow for me? He swallows, I advance. And then as he starts to breathe again, then I know that it's in the right place. I continue to advance to 64, hypothetically, but because this is a mannequin, we're not able to do that. If Mr. Jones were to continue coughing or gagging, I would take my tongue depressor and a flashlight and check to see if I had got it in the wrong spot. I would check to see if I had kinked it or gotten anything twisted, in which case I would try and straighten it out and then continue inserting. If even after that he continued coughing and gagging, I can assume that, or he can't talk, I can assume that it's probably in his trachea and I need to immediately discontinue the NG tube. In this case, none of those things happened. So I have gotten his tube in, and I'm gonna kind of carefully secure it loosely. All right, and then I'm gonna get my, where's my tape again? Get my longer piece of tape and secure it. Then we would have an x-ray come and confirm placement, because that is the only way to like completely and totally know that the tube is in the right spot. So I am just making sure that this is totally secure. Right. All right, so we've secured, done the first step of securement. Okay, Mr. Jones, the next thing that I'm gonna do is I'm gonna aspirate some of the contents of your stomach to make sure that it's in the right place still, okay? So, I am going to get my syringe, and I'm going to clamp. I'm going to remove the vent and insert my syringe and unclamp. I'm going to remove 20 to 30 milliliters of content, remove my syringe, and touch it to my pH strip. That is going to help confirm whether it is in the right place or not. Gastric pH should be 5.5 or less. I'm going to reinsert my syringe, unclamp, put the content back in. I was also checking for the color to see if it was appropriate for the stomach. We're going to reclamp, remove my syringe, and set it to the side. And then I am going to continue to clamp and take my tubing here that connects it to suction and connect that to my NG tube. So I had placed this prior to this, and I'll connect those so I can unclamp. And then I'm going to turn it onto low continuous suction to be pulling that fluid out of Mr. Jones's stomach. Mr. Jones, how you feeling? He says he's feeling fine. All right, so we're mostly done, Mr. Jones. I just gotta do a couple more things. So I'm checking to see what color comes out into that canister, making sure that it's appropriate for Mr. Jones's for stomach contents. I'm gonna document, of course, what color that is. And then the next thing that I'm going to do is secure the tube. If this were a double lumen tube, then I would make sure that the vent is secured higher than the stomach. This isn't, so that's fine. Additionally, Mr. Jones, I'm gonna take this from you. So you're gonna be on an NPO diet, and what that means is you can't have anything by mouth. The reason that we're doing that is because We can't have anything going down your esophagus and into your stomach while we're pulling stuff out of your stomach. So we're going to be keeping a close eye on you, making sure you stay hydrated and all that stuff. But unfortunately, we can't have anything by mouth. I would offer Mr. Jones oral care and continue to do that every 2 to 4 hours to make sure that he is comfortable, and lubricating his lips and oral mucosa just to make sure that everything's okay. Then I would return Mr. Jones to a position of comfort and lean him back a little to like the semi-Fowler's position. Future call light, Mr. Jones. I want you to call me if you have any like respiratory issues, or if you feel like you're gonna vomit, if you feel any pain in your stomach, anything like that. I want you to call me and tell me, okay? He says yes. Wash my hands. And I'll be back in to check on you, okay, Mr. Jones? Awesome. Take all of this stuff out of his room. So at this point, I would document the placement of an NG tube. I would document the length of tube that has been placed in the patient's body and that it is marked right where his nose is. I would document that there's fluid coming out of the NG tube. We checked placement with the X-ray, pH, and aspiration. I would document the color and pH of the aspirated fluid. Then I would additionally document that the tube has been hooked up to suction, continuous suction, and I would have marked on the canister if there was any fluid in the canister when I left the room, so that I can be monitoring how much every hour or so is coming out of Mr. Jones's stomach. And I would have documented the color and the amount that had come out, mark it on the canister so that the next time I knew. I would, of course, document date and time and patient's toleration of the procedure. I think that's it.